Hey, it's Dr. Appalraju again, and this is a continuation of my previous post regarding heart attack and women. And the rates are quite high, and often 30 to 50% of women who go to the hospital by emergency physicians or their doctors are often misdiagnosed as something else and not heart attack. So I want to just mention a couple things that might be life-saving for you or a family member, especially if you're female. So if you have a family history of heart attacks and strokes, pay attention. If you're a smoker, if you have diabetes or possibly pre-diabetic, there's a lot of people walking around with that. A larger midsection, right? You're not exercising, lifestyle factors, right? You're at higher risk. And if you're not going to your dentist on a regular basis, you're also at a higher risk for developing this condition. And there are certainly some genes that have been linked, but the major things tend to be the simple things that lifestyle changes. But what I wanted to comment, and I've got the book below me here that I mentioned before in that post. It's called Beat the Heart Attack Gene, and it's written by a couple authors. This book is a few years old now, so the data may have changed slightly, but it's still relevant to today. And one of the things that I found fascinating here was that after a heart attack, every minute counts. So it's very, very important you call 911 if you or somebody you know is having any of the symptoms I'm going to mention here. Now, for men, the typical symptoms are severe pain, left-sided pain, arm pain, jaw pain, a feeling of impending doom, sweating. So for women, quite often, those symptoms are slightly different. Now, they may have the same type of symptoms as men, but they might show up a little bit differently. And this is why partly a lot of women get misdiagnosed when they are having heart attacks, according to this book. So one of the things that I found fascinating here is a cardiologist mentioned that, so those minutes count, and the tissue in the heart starts to die after 30 to 60 minutes, probably a little less than that, I would suspect, if there's no blood flow. And so they call that the golden hour. If you have any of these symptoms, you need to call 911 and get into the hospital and be assessed, because once that tissue dies, you cannot get it back. And that is really significant for downstream effects for people. So these are warning signs that they've listed here. The first thing would be shortness of breath. During a heart attack, even sometimes days or weeks before, they're reporting 58% of women report panting or the inability to carry a conversation. So they're having difficulty breathing. And sometimes they'll just put it, oh, I'm just tired, or I had a rough day, or I'm exhausted, or the kids kept me up. But pay attention to that. The other one is non-chest pain. Instead of this explosive pain that men experience, many women develop less severe pain. And that pain could be on their upper back, their shoulder, their neck, their jaw, or their arm. And it might even be on the right side, not even on the left side of their body. The other thing that women tend to experience that's a little unusual is fatigue. They get unusual fatigue. And 71% of the women that they had surveyed had flu-like symptoms, very unusual fatigue weeks before they had a heart attack. They were tired to make it to bed, even lift a laptop or walk to the mailbox. So that is an interesting finding. The other thing is that women tend to have heavy sweating, and quite often they're suddenly drenched with sweat for no apparent reason. Their faces become pale and ashen. And often women will dismiss this, especially if they're menopausal age, as a symptom or hormonal changes related to that. So you don't want to discredit what's happening because it possibly could be a heart attack. The other thing that they've documented here is nausea or dizziness. So during an attack, women often vomit or feel like they're going to pass out. And sometimes it could be a sudden or unexplained fall. That's also a warning sign for women. So pay attention to that. So anxiety is another one. So many women experience a feeling of impending doom or fear before a heart attack. That's basically their body's telling them, hey, pay attention. Something's going on that's not right. Sometimes it's an inner instinct. So you want to listen to that because sometimes it's life-saving. Okay. So I'm going to go through those again because these are possibly atypical signs or symptoms that you may be having a heart attack as a female, as a woman. Shortness of breath, non-chest pain, unusual fatigue, heavy sweating, nausea or dizziness, anxiety. Okay, so those are factors that you may be experiencing either alone or in combination that might lead you to discredit the fact that you're having a heart attack. And so don't do that. Get help, get assessed. And sometimes if you're not happy with the result, get reassessed. Don't leave it because that tissue, once it dies, doesn't come back. So you want to get seen by your emergency room or your physician within that 60-minute or earlier. The earlier, the better, right? There's no blood supply, tissue dies. And especially in your heart, you don't want any tissue to die. I hope you found this section useful, and perhaps it might save your life or a loved one. Don't discredit some of these symptoms and signs that you might be feeling as I'll just put it off, or I'm just going to go lie down and have a nap. Sometimes it's more significant findings. So, be aware of this. I hope you found that useful. Remember, you only have one life. Live it well. Take care and stay well.